Let's move on. Item 10, which is the CCG assessment year-end ratings. Matthew, over to you.
Thank you very much. Yes, we are publishing today the annual assessment of CCGs, as we did this time last year. Those assessments split across 5 domains: leadership, finance, performance, planning, and their delegated functions, and consolidate about 60 indicators into those in order to give us a rating which we use at the request of the Department of Health, the Ofsted style language of outstanding, good, requires improvement, or inadequate. The final ratings that are out show some improvement across the CCGs, with our number of outstanding CCGs increasing from 10 to 21, good from 82 to 99, the number of requiring improvement falling from 91 to 66, and the number rated inadequate as falling from 26 to 23. We will be working with the poorer rated CCGs to help them move forward, and our those organisations that come into inadequate have been placed into NHS England's special measures regime in order to allow closer involvement from our regional teams to support those CCGs. We've also established a commissioning capability programme in order to support both focusing on the needs of the CCGs that are struggling most, and we'll be working with NHS clinical commissioners to wrap a package of support around those special measures CCGs, but also to develop more generally the capacity to commission the priority programmes around cancer and mental health and so on, and also to develop the set of skills that CCGs will need going forward as we move into the world of STPs and accountable care systems, and into increasingly focus on commissioning for population health improvement and away from the click of the turnstile approach that has gone before. So we are also publishing today the assessments on cancer, mental health and dementia onto our website, with commentary from the expert panels who have supported that process through the year, which also show an improvement across the board, but a journey that we are still on and much work still to be done.
Good. Thank you, Matthew. The rating of inadequate of the 26 reduced to 23, how many of the 23 were in the 26?
There are a small number off the top of my head. I think it's around 8 that have continued from. Is it 8? Yes.
It is 8. So people, CCGs are going in and out of categories in successive years.
Yes, and we've been intervening in CCGs to help them improve, and there are different reasons in different areas for why organisations fall into inadequate. So we need to have and have been having a targeted intervention to help them, be it finance or governance or waiting times or the particular parts of the ratings that they need support in.
So let me invite comments, queries. David.
Malcolm, the board should be aware the commissioning committee gave this a good kicking to make sure that the process was robust, was supported by appropriate data, and in particular the boundaries between various sort of assessments were also robust. And indeed there were some challenges made, there were some changes to the methodology and to the explanations therein, as a result of which the committee was happy to support and to assure the board that it has been looked at in great detail, and therefore we would recommend it.
Yes, well, thank you. On that basis,
Victor.
Victor.
I just wanted to make the point that while it's important that we do have these transactional interventions, the process is fundamentally transformational, and we note that where it's working well, it's relational. So, and we don't know any more than they do. So I just wondered about how we are encouraging joint learning and a real sense that this is something that we are no more expert at than they are in some ways. So therefore, how are we doing that from the top, and just ensuring that we're on this journey together?
It's a very fair question, Victor, and it's why we're working with the NHS Clinical Commissioners, which is the organisation of CCGs and of primary care, to enable us to take the learning from the best organisations and how they operate and transfer it to the ones that are struggling, because there's no magic manual that we own and we choose to share with people. There is actually building functional organisations is an iterative process that is about people and processes.
Good. Thank you very much, Matthew.